Bo and Luke Nation, welcome to another episode of the Bo and Luke Show. I'm your co-host, Luke Carignan.
And I'm your other co-host, Bo Bravo.
Yeah, you are, Bo. All right, everyone. Today, we have an awesome guest. We have Chelsea Tooker, who is a registered nurse at the medical ICU at Northwestern University Hospital. Folks, this hospital is in the thick of things right now in Chicago, probably one of the most high volume COVID units that we have in the United States. And we're going to listen to how she's dealing with things right now and what she's seeing out there. And hopefully you can use all this information to help keep yourself safer and also maybe share it with your friends and family out there to help somebody else that might be a frontline worker. But before we jump into all this, we've had some great feedback from our website and on social media. And we just wanted to say thank you to everybody out there. If you haven't been there yet, Bo has been working tirelessly. And when I mean tirelessly, I don't think the man has slept. He's been working day and night, just slamming coffee, putting together this website. It's theboandlukeshow.com, theboandlukeshow.com. Bo, do you want to say a few words about the website?
Yeah, folks. Hey, check out the boandlukeshow.com website. If you would, if you want to learn about the microphones that Luke and I use, the headphones that we use, so we can hear each other well and hear our guests well. And that really, so we can produce some amazing audio quality. We got it all there. So you go to the website, click on sponsors and affiliates up in the top right corner, and you'll find all kinds of information, not only about our tech gear that we use, because we're doing all of our recordings from home. You can click on different things like 360training.com. Luke and I are all about doing better. You know, for everybody, that's the inspiration for our show, to do better. So 360training.com has over 6,000 training courses you can actually utilize while you're sitting at home, right from the comfort of your own couch or your bed or your home office or whatever, where you can get new skills and training and prepare yourself for your future. So check it out, theboandlukeshow.com. There's also a place on there for you to send Luke and I feedback. So we want to hear from you. Like he said before, we love getting information from the audience. It helps us do better. We can't do that without having you critique our show. And we read them, we listen to you, and we act on it. So please send us feedback. Keep doing it.
That's right. That is correct. Well, without further ado, everybody, we have an awesome show coming up. Let's let it rip right now with Chelsea Tooker.
Let's do it.
All right, folks. As promised, on the line, we have Chelsea Tooker, who really literally took time off from saving the world to talk to Bo and I. So we're really grateful about that. Chelsea, welcome to the show.
Thank you for having me. This is, I've never done anything like this. So this is fun. I can check it off my bucket list. Thank you. I appreciate it.
Absolutely. Absolutely. Well, you know what? Bo and I haven't done too many episodes either. So, we're all learning as we go.
Absolutely. This is literally what I think our 14th recording. So you're in good company, Chelsea.
But literally, you are being a superhero out there right now. Everybody, Chelsea is a registered nurse at the medical ICU at Northwestern Memorial Hospital in Chicago. And I lived in Chicago for 12 years. Bo, I know you spent some time in Chicago as well, just going through like tours with Obama and things like that, right?
1 week in Chicago in the winter of all times.
Oh,
yikes.
It's a beautiful place.
Yeah.
And if anybody hasn't been there, just picture Chicago, the beautiful skyline. You have the Hancock building, which is one of the biggest. And right smack dab next to that is Northwestern Memorial Hospital. So where Chelsea is not somewhere on the outskirts that doesn't see any action. This is an action-based hospital, and anyone that's in Chicago knows that. It fuels, right, Chelsea? I mean, pretty much any of the most serious cases that happen on the north side of Chicago come to you, right?
Northwestern, yep. We are a trauma center. We handle our ER is one of the busiest in the state, so it's definitely. I'm never bored, and we're always busy.
I bet.
Yeah.
And we have Chelsea on today because, for obvious reasons, Chelsea has been dealing with the COVID crisis now since it's been going on, and I guess started seeing it through the beginning of it. Is that correct?
It is, yeah. So I was in preparing to talk to you guys. I was kind of looking back at how long we've been, how long our hospital has been in this crisis, and it's kind of for me. I think it started around like 2 days before St. Patrick's Day is really when our city kind of felt the first steps of closures because they closed down St. Patrick's Day festivities, which if you talk to any Chicagoan is a big deal. We dye the river, we have the parade. I mean, everybody's, partying at 9 a.m. So that for us, when they closed that down, everybody was kind of like, oh, okay, this has become real. So yeah, I would say around March 15th, we've been at the hospital starting to prepare for the worst. So
I guess first question, how are you doing?
I'm okay. Well, people ask me that a lot, and I say that first, and then I say that I'm healthy. So I'm doing fine. I guess I mentally wasn't prepared for how much stress I would have personally, I would say, but I'm doing all right. I mean, I typically work part-time, so I work 2 12-hour shifts, but since I would say the beginning of March, I've picked up an extra shift, so I'm full-time, so I can't complain. I haven't had to work any overtime or anything like that, but I'm still working more than normal. So I'm doing all right. We're hanging in there.
Good.
Yeah.
Chelsea, how long have you been in the nursing profession?
So I graduated in 2007 from Salisbury University in Maryland, which is where I'm from. And then I worked for 3 years in a cardiology ICU at Johns Hopkins Hospital. After that, my coworker and I decided that we wanted to move somewhere. So she wanted to move to Denver and I wanted to move to New York. So we met in the middle and we chose Chicago and we moved here in 2010. So I've actually been at Northwestern in the medical ICU since 2010.
So before we started recording, we were privileged to see your daughter in the background.
Yeah.
Has this impacted you and your family as far as daycare, you having to go to work, your husband working? How has it impacted your daily life and picking up extra shifts?
Luckily, my husband has been working from home now for about 9 months. So that part didn't change for him. He still luckily has his job. So that's comforting. My kids also I have a newly turned 5-year-old from April 15th. She turned 5. So her and my youngest daughter, Lillian, they go to a daycare that supports Northwestern Memorial Hospital. So that has not closed down. That actually has a special license to operate in crisis. So it can stay open. That way I can go to work. So they're actually, I mean, they know what it is. They have taught them in their school, like about coronavirus. And my 5-year-old, she talks about coronavirus, here and there, but she knows that she needs to wash her hands more, and all her teachers are wearing masks. And, my youngest daughter tries to say the word coronavirus, but she really can't, but they understand what's going on, and they call it the germ. So the germy has taken over. So they know what's happening, but they've been healthy, which is good.
That's great. Luke, Chelsea just brought up a great point that I pulled out. One of the very key things that she said there was that the daycare facility has a special license certification to operate during a crisis. When we talked on our last one of our last episodes that actually comes out tomorrow was with one of the co-founders of JetBlue, Mike Barger, and we talked about airline industries having or being required by the FAA to have emergency action plans. So when crisis happens, they basically just pull out the book and they follow their emergency action plan. So I'm wondering, in the months to come, the times to come, will more industries actually take action and create things like, emergency crisis certification, so that when things like this happen in the future, because it's not like pandemics don't happen it seems like they happen every decade or so, something happens, right? So that we actually respond in a better way in the future, in years to come. So I think that was a great point. think that's really, really great point.
Yeah, that's huge. And I don't think anywhere in the city where I live, in fact, I'm positive, I don't think they have licenses to operate during, that's been a big question mark in our area, is to where people are going to get childcare and what it's going to look like. And they haven't shut down any of the daycares yet, but that's super cool that they had that plan.
Yeah, it is. And it's nice because it's comforting for me because their lives haven't changed. Everything around us seems to be dramatically different. And for them, they're like, yeah, I know I can't go to the park. And I'm like, oh yeah, but other things are also different. They're lucky enough. They still see most of their friends. Their teachers have chosen to stay at their school. So that also provides normalcy for them.
That's really good.
Yeah.
That's really good. How is this? So I know you're seeing it every day, and there's two sides of the coin here of people in this country, I think. By the way, people in this country, always there's two sides of the coin to everything. But one of the things that I hear people say is like, oh my gosh, it's like no worse than the flu, right? From your perspective, I mean, you're seeing it every day. Yeah. Is it different? I'd like to just hear it from somebody that sees it.
So at the beginning of this, I guess I should go back a little bit. I have a nurse that I work with, a coworker of mine that I truly trust when it comes to these massive diseases that just take over places and kill lots of people. And she has traveled so remember back in 2015 when Ebola was like a very real threat to the United States and to the world, really. And there were outbreaks everywhere. She actually traveled to like these crazy places in Africa, set up medical teams and like ran a hospital in the middle of the desert for like Ebola patients. So when this happened, when coronavirus started making its way to the United States, I went to her and I said, look, I want you to tell me if I need to be more concerned than what the hospital's telling me and more concerned from what the media is telling me, because I trust you and you understand. And she actually told me, she goes, right now, and this was very early March that she said this, right now, the flu is actually killing more people I don't know if she said world or United States. The flu is actually killing more people than the coronavirus right now. And I was like, all right. But then as things started drastically changing, she came to me and she was like, what I said before applied then, that does not apply now. And I think we should all be very worried about what's to come. And now here we are. So I don't think that we can't say that anymore, but that is something that people were saying early on.
Yeah, it's just so interesting to hear it. Is it, and are the patients different have you seen patients come in with the flu that are in a similar, I guess, how does it act and attack the body in different ways?
So when the people that the flu and coronavirus attack are people that are immunocompromised and the elderly, and also infants, right? Anybody that has another medical condition, diabetes, obesity, hypertension, all of those things that cause cardiac illness also make you more susceptible to COVID-19 and influenza. So what happens is you get this virus and both are viruses. You get both of them and they attack your ability to ventilate and oxygenate your body. So your lungs become damaged and you go into something called ARDS, which is acute respiratory distress syndrome. And you need a ventilator and you need sedation medication to keep you synchronous with the ventilator so that your body doesn't fight against a machine breathing for you. The difference is both of those viruses cause ARDS. They can cause, not all the time. The differences with COVID-19 and the flu are that the type of ARDS that COVID-19 patients go into is so severe that their lungs become fibrosed very quickly. They become tough. And so it becomes even more difficult to ventilate them and sedate them. For some reason, they're requiring these crazy doses of sedatives that we haven't used, basically that we use to put out people that are having like massive seizures. We're having to give these COVID-19 patients in order to ventilate them. So it's a different type of ARDS. I would say that is 3 to 5 times more intense than the flu, if that makes sense.
Yeah. Wow.
Is it letting up at all in Chicago, or is your unit, like, I guess when you go into your unit, is it completely full right now with people? Is it let up at all? Is it?
Sure. So no, yesterday was my busiest day by far. I was so tired yesterday. My legs were burning at like 11 a.m. in the morning. It was my second 12-hour shift in a row, and I'm a little bit older, so that's probably why that happened. But like, I was running around the entire morning. I did not stop. So I guess I should preface by also saying at Northwestern, what happened was when all of this started unfolding and when our hospital had to come together, management, directors, clinical coordinators, which are just basically assistant managers on each unit, they all came together and they thought, what are we going to do? Like, what is our plan? Because the MICU, where I work, the medical ICU, would be the ones that are the experts in treating these patients. So somebody like a nurse or a doctor that treats a heart attack is not necessarily trained to treat patients in ARDS. Mm-hmm. The MICU staff are. So they came to us and they said, let's make a plan. So what we did was we turned the 3 units into COVID-19 ICUs within a week to 2 weeks. We've completely flipped them from being step-down units into ICU units. One of them can hold, oh no, I've got to do math. Let me think. What's 13? Okay, so we got one of them can hold 33 patients. The other one can hold 41. And then the one that I was in charge of yesterday, I think can hold 23 or 22 patients. And I went in yesterday and my unit only had about 4 open beds. So we were, 18, 19 patients full by the end of the day. And then the other units had close to the same. So it was my busiest day for sure yesterday.
Wow. How long are the patients? What's their typical stay? Like how long are they there for ones that recover?
Sure. So I guess it's hard to say because the medical surgical floor, so like we call it a med surge floor. So a floor that does not provide ICU care. There's also, I think, 3 or 4 of those at Northwestern too, just with COVID positive patients, and they are completely full. So
wow.
Yeah. So it's like close to 7 units at Northwestern that have COVID positive patients, ranging from being on just a nasal cannula in your nose to being fully intubated and on my unit. So if the patients get intubated, which means they get a breathing tube put down and they are in an ICU where I work, then, I mean, it all depends, but at least a week is what we're seeing, at least a week on a ventilator.
Wow. So that's when they're transitioned to you and to the ICU is when they get to the point where they need to be intubated, sedated, have the ventilator. That's when they're hitting the ICU. Wow. How do you think your unit, I mean, just your unit in general, everybody handling it okay from your perspective? Is the hospital doing, I mean, you just kind of gave us a good example of how everybody came together to make a plan. And now you're executing the plan, it sounds like. So your unit doing okay?
Yeah. I mean, right now we're functioning as one giant group of like providers. So like physicians, nurse practitioners, CRNAs, and then nurses from all of the ICUs have just come together and have just really stepped up. I'm very impressed by the way Northwestern has handled every single request that we brought to them. Mm-hmm. So at the beginning, we requested that we wanted scrubs. Like we knew the CDC was telling us that like, it doesn't live well on fabric, but we asked for scrubs. And then a couple weeks later we had scrubs. And then we asked for free parking, which some would think should just be a thing for nurses.
No, I get it. Yep.
So then they gave us discounted parking. So that was, I mean, and I have never gone into work recently or at all really at Northwestern where I haven't been provided appropriate PPE. I really think that it's so unfortunate. I hear stories about community hospitals in rural areas that, I mean, these nurses and doctors are going into these rooms and these patients are like cardiac arresting and they're doing compressions and they have no mask on. I mean, You're literally breathing in COVID-19 aerosolized virus as you're doing compressions. And that just like breaks my heart because there's no way they won't get it.
Yeah, that is a great comment. I love it. I have a good friend who's a vascular surgeon and she writes a blog and she's making comments about PPE. And she said the one thing that was disturbing her as a healthcare professional was seeing people making posts and comments and about like not having or not being used to wearing PPE. So her comment was she wondered if they just don't have the PPE or are these people just like not used to wearing PPE, which is even a greater concern, right? COVID or no COVID,
It's
right?
probably the second thing.
Yeah.
It's probably the second thing. Yeah, because
Right.
I mean, or a mix of both, you know? I mean, she's a vascular surgeon. I mean, ask her when the last time she took care of a patient with active tuberculosis, and she'd probably say in her residency, you know? So again, it's a mix of people that are not used to being in the medical ICU mixed with like me who sees these things on a, you know, every time I work.
Sure. So it's normal. I mean, you getting in PPE. Yeah.
It's comfort level of I say putting on and taking off, but there's the words donning and doffing. You know, you don everything on. I can do that much faster in a situation because I've done it my whole career.
Mm-hmm.
You know, so that helps in emergency situations. Somebody that knows how to put the stuff on quickly.
Yep, I would agree. I spent 26 years in the Army and had to don protective gear and gas masks. And you're timed. And they get out the timer and test you, and you got to get it on in a certain time frame. So I've been having flashbacks watching all of the healthcare professionals have to do this now. Yeah.
And so, what is for the listeners and for folks like me with less of an IQ out there? Can you explain what the donning and what was the other word? Doffing.
Donning and doffing. So donning means putting the personal protective equipment on prior to going into the rooms, and doffing is removing the PPE in a secure location and then coming out of the patient's room.
Ah, okay, I see.
Yeah, so and we've done a very good job of clustering our care, is what we call it. So the hospital has allowed us certain leniency on giving medications. So like, I don't have to give, you know, the multivitamin at 10 a.m. anymore. I can give it whenever it sees fit that I'm going in the room. So I don't have to go in and expose myself more times than are actually needed. That makes sense.
Gotcha.
That's good. How's everything working? Like with the treatments that you're giving and providing to people, are you seeing things work in a positive way? Is it just an uphill battle? Like, what's your opinion on everything?
So it is very humbling because I've done this for a long time. Obviously, I've been a nurse for, I don't know how many years, 13 years, 12, 2007. Did I say? Yes. Yeah. So a long time, but it's very humbling to now be learning new and being part of new medical trials. I mean, we have so many medication trials going on right now, like the one remdesivir that I just read about on CNN. Like, we have been trialing that since March. So I was like, oh, that's cool. But we've been doing that since March. So that's
wow,
very neat, you know. And there's other ones. They all seem to be antiviral medications used for like HIV treatments almost to prevent like a virus from flourishing. They kind of like pushes the virus down in your body and prevents it from overtaking other functions of the body. So that's been really cool. I mean, we were a part of this trial last week where we put our masks in this bin and they were taking them away to a study facility and cleaning them with hydrogen peroxide and then, I guess, testing them to see if they were effective. So like reusing N95 masks. All of those things I have seen positive results from remdesivir, from other medications, from proning. I don't know if you've heard of that, so it's a treatment for ARDS where you take a patient that is completely lifeless, basically. So they're intubated, they're sedated, they have tubes everywhere. So they have one in their stomach, they have one in their airway, they have a Foley catheter in their bladder. And they're basically like just, you know, they don't move, they're restrained. And we take them from laying on their back in the hospital bed and we prone them onto their stomach. So we flip them onto their stomach. It takes about 4 people and a respiratory therapist to make sure the breathing tube's secure. And what it does is it allows the body to increase the blood flow to the base of the lungs and be able to open up the lungs and oxygenate the body a little bit better.
Interesting.
That has been, I think, more effective than any medication. Is just
really
the patient.
Yeah, I mean, it sounds like, I'm thinking like gravity, right? Gravity pulling things down to help the lungs open. And wow, interesting. That's
And it
fascinating.
mobilizes secretions. As soon as we flip them, we call it, I mean, we call it like drowning them. So you flip them and all of a sudden it's this rush of secretions out of the breathing tube. And you're just sitting there suctioning. And you like sit them up a little bit on their stomach, you know, and they're laying and their oxygen saturation goes to 100%. It's like, and we're like, okay. So
Wow.
it's very like apparent, very quick results.
Wow.
Wow.
Yeah.
I haven't heard of that.
No.
Yeah.
What about hydroxychloroquine? Are you using that medication?
The
treat?
physicians I work with have not even brought that up as a treatment. I am not aware
Really?
of any of our patients being on that. I think that was something that gained a slight bit of media coverage and they just like ran with it, honestly.
Yeah, that's what's really hard. And I think it's great for all of our listeners to be able to hear from you directly. Because there's just so much media out there and you really don't know what to believe, right? Whether it's good or bad. And you'll hear one snippet and I've heard a few of them and they've actually been doctors who have posted, whether they've posted on Facebook or LinkedIn or some video of themselves talking, where they gave hydroxychloroquine to a patient and they were like cleared up in a few hours. But obviously that's not
maybe
like prevalent everywhere.
Exactly. And every patient, we always say every patient is different. I mean, you have to treat the patient that's in front of you. And that's something that I almost like, that's how I practice nursing. And that's how I try to coach new nurses also. Is like, you cannot foresee what's going to happen in 1 hour in the ICU because most of the time you will be wrong, but you just have to treat what's in front of you. And you can't plan for the future in the ICU. That's not a thing. So.
Wow.
Yeah. It's so, I'm actually on hydroxychloroquine because I have rheumatoid arthritis.
Wow.
And something struck me when they came out and, said like it's working. Well, the first thing that came to my mind is I said, well, it's kind of weird because it takes 6 weeks for like to build up into my system before I feel any relief in it for it at all.
Wow.
Yeah. And so we know like from COVID, you probably don't have like 6 weeks of runway for something to kick in.
No.
And then second of all, it's just, I was in, this will be my public service announcement to other people out there. If you're hoarding hydroxychloroquine, stop.
Yeah.
I need it. I do. I actually really need it. Walgreens won't give me any more than like a 7-day supply. And the reason being is that doctors are like writing scripts and people are hoarding it at their house. So if you're listening and you're doing that, stop doing that.
Yeah.
Yeah, that's amazing.
Unbelievable, right?
It is. Yeah, it really is.
So is it so in all these drugs? So like I'm also on Xeljanz. That was another one that I heard that they were trialing on some of these. So is there an element? I know all of these are, I don't know about remdesivir, but I know all the ones they mentioned are mainly immunosuppressants.
Right.
So are these, is what's happening is like the immune system is overreacting to what the virus is doing and attacking the lungs, or how is that working?
So, two things. You brought up a very good point in that I actually don't know a lot about the medication that you're on and the one that's getting all, that it's getting all this attention, but,
that makes two of us. I just take it.
Yeah. No, that's wrong. You should know.
Good advice, Chelsea. That's very good advice.
I do know that rheumatoid arthritis is a disease of inflammation, right? It's an autoimmune disease that probably was passed down in your genes that you just have to treat and it can't be cured. Is that true?
Yes.
So it's inflammatory. And a lot of these patients that we're seeing, actually all of them, have an inflammatory response going on within their body. So there certain markers that we draw from your blood are just crazy high, which indicates to us that something inflammatory in the body is going on. That's why they're telling you not to take Motrin, because if you have it, because that's an anti-inflammatory. So yeah, it's that might be the connection there of why they're prescribing that drug, is because it's might be used to bring down the inflammatory response. I'm not sure, but I think what you said earlier about the virus attacking the lungs is very true. It's definitely a virus that once it gets a hold of your lungs, it kind of just it does really overtake the function of them, and you become hypoxic. So the ability of your lungs to ventilate and oxygenate the rest of your body just ceases.
Wow.
Yes.
How do you feel about what's going on in the country, right? There's like, I don't want to call them riots. There's protests, we'll call them,
Yeah.
going on all over the country about reopening. Georgia is opening up massage parlors and bowling alleys, which is actually a really weird thing to be reopening first, but whatever.
Yes.
What are your thoughts on that? Because you're in there seeing it every day. Like, is this like, are you comfortable with that? Or are you like, hey, this is a horrible idea or middle of the road?
I saw those pictures on Monday. I think I saw them on CNN, and they were the Denver protest, which is the nurse or the physician in the green scrubs and the N95 like blocking the car. And that was very angering. I don't agree with people just being stir crazy. I understand that they need to make money. I understand, but maybe that's what the stimulus checks were for. I don't know. I shouldn't get into that because I'm, but I think that you're in anything that you do, you're not going to please everyone. But right now is not the time for you to be going out and getting a massage. I mean, there is, like I said, yesterday was my busiest day since this whole thing started. And since I've been at Northwestern for years. So it's like, this is not ending and this is not slowing down. And I'm sure the patients that are laying completely incapacitated, passing away without their family members present, wouldn't agree with you going bowling either. So
yeah, that's a deep topic, right? So speaking about that, you've had deaths in your unit, or Northwestern has had COVID-19 related deaths?
Yes.
And your hospital has, on the website, they have their updated visitation policy posted. And it says that no visitor policy in our outpatient care sites for COVID-19 patients. Have you had, because it sounds very sad to me that a COVID-19 patient might pass away alone and without their family member or somebody present, a loved one. Is that happening? Has it happened on your unit? Yeah. Wow.
Yeah. And that was another thing. That was a very personal thing for me that I did not expect myself to find that to be emotionally debilitated. And that sounds kind of like I have a cold heart, but I have to, MICU nurses and ICU nurses in general, our personalities are different than, say, your pediatric outpatient nurse. Not every doctor is the same. Not every nurse is the same.
Sure.
So we definitely have personalities, and my coworkers just understand. If they listen to this, they will understand, is that we don't really connect to our patients like the oncology nurse would. That's not really in our makeup, because typically when you're in the NICU, you're very ill and your chances, not all the time, but most times are not very good. So for me, when, at first, when we heard that there were going to be no visitors, I have to admit it does make our job slightly easier, but it was very eye-opening when that first patient was going to pass away and the family chose to withdraw care and they could not be there. And the patient, the patients that are in these rooms and in the ICU, they're not alone. I want to make sure that that's clear to the families too, is that in no way is no one around them all the time. I mean, we are constantly looking at them, talking about, oh my gosh, their daughter called, she seemed upset. We have advanced care providers that are literally, their only job is to call families 4 times a day. So we want you to know that they are not lying there alone. We are there, but still, we don't know them personally. So when these patients are going to pass away, we do have iPads that we connect through FaceTime, and we're able to let family members see them and say goodbye. But that to me was like, wow, I just, and then I see these protests and I just don't understand if people on the outside know how bad it is where we are.
Yeah, that's a good point. I think we can definitely be grateful for technology. I think that is fantastic that you are opening up a FaceTime or some real-time audio visual capability for the family members to see their loved ones. If nothing else, it's virtual, but that's better than nothing. So I think that's great. So I definitely hats off to Northwestern for doing that. I hope other hospitals are doing the same for sure.
Yeah, I think they are. I think it's definitely, I mean, some nurses have like taken their phones in if they can't find an iPad, and they're using like their own phone to just like, we have the phone for ourselves too. And we get to meet the families. And the other day I Zoomed, or I don't know, FaceTime, Zoom, whatever I'm supposed to be using is what I use. And it was like 6 different family members, and it was a grandfather. My patient was a grandfather, and he had like his 2 daughters in the screen, and I got to meet his granddaughter, and they got to see me, and they got to see him, and they were all praying. So that was nice.
Incredible.
Wow. I think you're going to change a lot of minds, Chelsea. I do. When people listen to this and just hearing it from you, being on the front lines and what it's like in the day to day, because I don't think people don't get to hear that.
No, they don't. But don't you think at some point not at some point, it's happening now with the protests. But there's a collision point between healthcare and everybody else, because everybody else is ready to go back to work. Jobless claims are at an all-time high. Some economists are saying, if this goes on for another 45 days, the Great Depression is going to look mild. So, there's got to be, and I think people like you, Chelsea, you're definitely part of the solution, because you're treating the patients firsthand. You have direct experience with it, where just like your team of hospital professionals all came together to make a plan. I pray that that's happening in government, in local, state, federal government, that people are actually coming together in concert with our healthcare professionals and trying to come up with legitimate plans. Yeah. And then, communicate it. Communicate so that people know something's happening. There's plans in the works. We're going to execute shortly, whatever it is, right? That helps keep the most people safe as possible.
Yes.
Yeah, I agree with that. I think that, especially because you're able to go in there, and I mean, I know you have a lot of coworkers and you're using the PPE very responsibly, successfully as well, using it, which is great. I think there's a lot we can learn from that to maybe start easing up a little bit on it so that people can get back to work. Now, I think that bowling alleys and massages are a little bit aggressive. And if the governor of what is it, Georgia, tunes into this, then we welcome you to have a debate with Chelsea, and she's going to win. She's going to win, by the way.
Yeah. It's so hard for people and to make an informed decision, because you even have states in this country like South Dakota. I think there was like 8 states that did no lockdown. They did no shutdowns, no lockdowns. Sweden didn't do any lockdowns. And so it's, that automatically makes it a controversial topic, right? Because not everybody, but then you have others that have gone to even a further extreme, like in Michigan, and you can't run your motorboat. So you got people wondering, like, what in the world is really going on, and where do we get the truth? I think that's what it is for me. It's like, what is the truth? And I think what you're telling us today sheds light on that. It really does.
I would say that there definitely isn't a day that goes by where it's easy. There's nothing about these patients that is simple because, they're, like I said before, sometimes if they're lucky, they're intubated for 7 days, but you get to day 14. So you get to week 2 and we're talking to your family about a tracheostomy. So, because, you leave a breathing tube in for greater than 2 weeks and you risk vocal cord damage. So day 13, day 12, day 13, our physicians are calling your family and saying, now we're going to put a tracheostomy in your family member's, neck, and next they're going to need dialysis for the rest of their life. And so, this isn't, and they need to go to an inpatient rehab for a month because they can't stand up on their own without a lift. So I definitely think that we are working so hard in the hospital as a team to get these patients home but it's going to be an extremely long road. I mean, we've got social workers, checking in with the charge nurse every day, with the physicians every day, whether or not patients are appropriate to be worked up for inpatient rehab. Not one of them has gone that I know of yet. So we are becoming inpatient rehab. So, this is no like short-term hospital stay for a colonoscopy. This is like a whole process that's going to last for months and really affect a family for months too.
Yeah,
it's a lot.
Man, it's tough. Do you know if Northwestern has had any layoffs since this all began?
I don't think so. I think we're hiring more people.
Are you?
That's awesome.
No, I've just read numerous reports on hospitals across the country that are like down 50% in revenue because their elective procedures aren't happening. Emergency room visits aren't happening as much as unless it's someone who thinks they have COVID. So people aren't necessarily going to doctors and hospitals and dentists and all those other places. So they're seeing a big hit on revenue. So it almost seems contradictory that we need our healthcare workers the most at this moment, but we still have
laying them off, right?
Laying them off. Yeah.
No, we have, I think Northwestern's done a great job of utilizing all of those people that are not able to do their elective procedures. So every day before we even enter the building, there are people with hand sanitizers. So you get a pump of hand sanitizer and you clean your hands. Mm-hmm. And then there's another person giving you a mask. That'll be your mask for the day that you wear throughout the entire hospital, elevators to go get your lunch, things like that. And then the next station are people on computers where you scan your badge and you deny whether you have symptoms or not. So you say like, are you experiencing any symptoms? You say no. And then you're allowed to go get your coffee. So,
oh, wow.
And all of those people, like yesterday, the person who gave me hand sanitizer was a dermatologist. So they want to help, but they don't, they can't be utilized in the ICU. So if he can stand there and make sure that we're all safe, then that's really great of him to do.
That's awesome.
So, we have something called a labor pool that the hospital created. I don't know. I think maybe other places are doing that too, where if you have had whether you're a physician or a nurse, if you've had any sort of ICU experience in the last, 10 years, you can apply to be like a resource nurse, or depending on your title, you can actually take a patient. So, and I think there's close to like 1,000 or something people in that labor pool that signed up to go back into ICU nursing, which if you ask an advanced provider, they're not going to say is their first choice. So it's really great to see all these people coming out of specialties and just being like, what can I do? Where do you want me to stand? And I'm like, go over there and wait till I tell you to send this ABG. So it's nice. It's comforting,
Yeah, no, I think that is cool. Yeah, I think that's super cool. I think that's a great example of an organization, your hospital, and the leadership. It sounds like they're saying, hey, we have this workforce and we're going to use this workforce and everybody's going to participate. And if that means you're finding a new spot to do that, we're going to make room for that because that's going to help us execute our plan as a whole. I wish more facilities would be doing things like that versus there's just too many stories out there of them taking the easy route and just laying people off. So that is super, super good to hear.
It's because Chicagoans are awesome.
Yeah.
That's why.
That's true.
And I think, without like going down a rabbit hole of like too much politics, but I think that there is from state to state, just a there's different scenarios for healthcare right now. So, you have like Northwestern Hospital I used to live right next to there. So I lived at the corner of Chicago and LaSalle.
Okay. Great.
So like right down the street from the hospital.
Oh, yeah.
And I can tell you, right? So I can tell you like firsthand, just from even like riding my bike past it, this is a high volume place that helps a lot of people. You're talking probably 10 to 20,000 people every square mile in an infinite radius around the hospital, unless it's the lake. But everywhere else other than on the lake is just very densely populated. Then you look at like, let's say a hospital in Wyoming where they're under executive order, where now they can't do elective surgeries and things like that. If they have nobody in their, like in a COVID unit in a regional hospital, and they have to cancel all elective procedures, which are the, generally the way that they make all their profit, it's incredibly hard to keep folks employed there, just due to those financial reasons. And it's sad. It kind of stinks,
No, I'm very fortunate that, I am where I am. And we do think about those that are less fortunate. And I don't know, I have no idea how this works. Ryan, my husband, could probably speak better, but like there has got to be some sort of state or government help to those places in Wyoming that you speak of. I mean, clearly, Northwestern, we're off of Michigan Avenue. We're doing just fine. We're number, I think, oh no, you got to go back and edit this because I don't know. I don't know if it's 9 or 11, but we're number 11 in the, in the country. So we will be just fine. But to those hospitals in Wyoming, that's very unnerving as a provider to know that when you walk into your job, you might not have what you need to perform essential functions and to save patients. I mean, that's why you're there. Like, I'm not going there saying like, no, I'm not going in. Like, of course you're going to run in if someone falls, but like that puts you at risk by doing that.
Yeah. And doing research for this podcast, I was looking up different stuff about your hospital, about Northwestern. And yeah, I think you're right. 9, 10, 11, somewhere in there in the country. You've received numerous accolades for being like hospital of choice for patients, very high survey remarks and comments, which is fantastic, which kind of leads me into one of the questions I would like to ask you. So especially coming from Northwestern Memorial, who seems to be getting it right and using their people and doing things the way we would expect or hope that most are, what are some of the best practices that you've seen? I mean, you've talked about a lot of them, but if there are other best practices that if you were in charge for a day at any hospital and would like to be able to guide them and advise them and recommend that they do, what might that be?
That's a great question. I mean, some of the best practices that I've seen are proning. So flipping patients on their stomach. Let's see. Utilizing, I mean, something as a charge nurse and just that I guess I'm used to delegation. Like it's not difficult for me to tell someone what to do. So just being able to use adult learning skills and speak up for what you need. And if that, if you say, I need your help in here, and that person says, I don't feel comfortable, move on and ask someone else. Like you cannot let your attitude and your ego get in the way of patient care or in the way of doing what's right just outside of a hospital setting. I mean, you have to be able to, as an adult and as a human being and someone who has the knowledge to help, you have to be able to speak up. So that's something that has never been difficult for me. Mm-hmm. And that probably also got me in trouble. That's what my mom used to tell me, is my attitude is the problem. But I've worked on it and everything is great. But I feel like those best practices of proning and just, I think being aware of the people around you and what they're going through also, because one thing that my family members have, we have shared is they text me every day, which is great. Like, love you, have a good day, we're thinking about you, which is like so comforting that they know that what I'm doing is important. But just being aware that, the 22-year-old brand new nurse out of orientation that's now caring for the 34-year-old COVID positive patient that probably isn't going to make it, being aware of her mental health and just checking in and being like, hey, how you doing? Do you want some water? Or like just little things like that. Everybody has to be aware that we can't get through this alone and we have to do it as a team because there aren't enough people to care for all these sick people. We have to do it together.
Yeah, for sure. We had We had a guest a couple episodes ago. It hasn't released yet. Her name's Rachel Noble, director of women's behavioral health with Inova Health System in Virginia, which is the largest nonprofit health system in Virginia. And we asked her about, it's interesting that you bring that up. And we should have asked her about this, because we were talking about potential long-term PTSD-like impacts to all of the moms who are now working from home every day, and the kids are home all day, and all the extra burden of trying to make sure they're doing their schoolwork, and then mom still has to try and work. And there could be some long-term impacts there. But you bring up a good point, because mental health and mental fitness is so important that this could bring about even potential long-term impacts or near-term impacts for people that are in the ICUs and dealing with this day in, day out. And right now, there just seems to be there's no end in sight, right?
Yes. Yes.
Yeah. So that could be tough.
I have a lot of coworkers who struggle with issues about, all aspects of mental health. I myself have had issues with depression and anxiety in a while ago when my mom passed away. So, all of those things are there. And that's another thing that is very humbling, is that you go to, we go in this every day. And for us, we're in it now, like almost a month and a half. So we've got a good flow. So you get to work, and then, you're kind of just like going through the motions. And then you leave, and you have to make time to check in with yourself and be like, am I doing the right thing? Am I getting enough sleep? Am I eating right? Why did I sign up for my 5th overtime shift in 1 week? Is that necessary? Like, am I really that poor, or should I just sleep all day and get my energy back up? So it's hard, because some of these younger nurses that are single, that are brand new, are going home to their condos, right down the street from the hospital. And that's the only human contact they're having is with their coworkers in this crisis.
Wow.
So I get to come home, and, Ryan has made me dinner, picked up the girls from school. He's got like a French bread pizza waiting for me. I'm like, this is great. So my mental health is on key. It's great. Yeah. But I don't know if that's the case for my other coworkers, and that's what worries me.
Yeah, that's something. Long time ago, I was serving in Iraq, and I had soldiers that worked for me, and they were assigned to the combat support hospital, and they were responsible for recording casualty operations. So anybody that was a casualty, whether they're wounded or killed, they were right there in the combat support hospital as these casualties came in, and they're documenting everything. And they were working 12 hours on, 12 hours off, 7 days a week for like months at a time. And it was literally, I think, maybe a year and a half ago. So we're talking, 13 years roughly. And one of those soldiers called me, actually shot me a text and said, "Hey, do you have a minute to talk?" And when I got on the phone, he just broke down. He's like, I haven't talked about this in 13 years, on the impact of everything that they saw, they witnessed, they were part of day in, day out. So, man, I know I'm such a supporter of mental health and people. I hate the stigma that sometimes people put on mental health, but man, it is so critical. And we all need mental toughness. Talk to people, have people that you can reach out to. So, your concern and care about your unit and the people on your unit is admirable, for sure.
Thank you.
Yep.
Yeah, it's so true. That's so true. You're doing all right, though? You're doing okay?
Yeah.
Sounds like Ryan's a great support system. Yeah. You have everything going.
Yeah. It's these days, Wednesdays, and I always either work Monday, Tuesday, or Thursday. So Wednesdays and Thursdays are my days where I'm in my pajamas all day. I'm eating beans with the girls. I'm just like, we're playing Uno all day long. So I've got ways to unwind, and I like to have a glass of wine and just look out the window sometimes. Yeah. So I'm doing okay. But I've had a lot of practice. I've had some things that have broken me down, and I've had patients that I still remember that passed away prior to COVID-19 that still I can see their faces. I know their names. But that makes me stronger because the next time I have a patient that passes away, I can somehow find strength in being stronger for my patient, I guess. So.
That's great. Do you have any advice for people that aren't as experienced with as you are, that are dealing with this, you just younger in their careers? Like if you had to do a shout out to people, that what have you learned to get through it, or what's helped you?
Oh my gosh. I'm trying to think of what, and when I lived in Baltimore, and worked at Hopkins, I had two coworkers, and I lived with one of them and the other one lived down the street, and we would all drive into work together. And sometimes we'd all go back to our townhouse and we'd get Thai food, and we would just drink wine and stay up too late and just talk about our patients and our boss. And it's okay to have your own opinions about things. And if you feel something's not right at work, maybe just going home and chatting over, a drink or something with a friend and getting their perspective is helpful. Because it might not actually be wrong. It might just be something that is against the way you were brought up, or it's just it's important to have an outlet somewhere with someone. It's
good advice.
Great advice.
Chelsea, you have been an awesome guest. Bo, did you have any more questions?
Oh, I don't have any more planned questions. We got all of the planned questions out of there, and I just want to say, thank you. I think it's a great perspective for everybody listening to get from somebody that's really, you're in the middle of it every day. To hear that perspective, and it's real, it's raw, it's relevant, I think it's very inspirational, and I think that our listeners can take a lot away from this, and hopefully they probably get more from this than they get from their news channels with all their 24/7 coverage of COVID-19 for the past 8 weeks.
That one. I don't know about that one.
Yeah, you're a superhero, Chelsea. Thank you for being you and just running onto that battlefield when other people are running away and staying home. And a lot of people are staying healthy and able to do a lot of things because of what you're doing. I'm just impacting a ton of lives in the city of Chicago and across the country just from doing what you're doing every day.
Oh,
so thank you.
I appreciate that. That's very nice. Thank you very much.
Awesome.
Of course. Well, at the end, we always say that's a wrap. So if you want to give it your best, that's a wrap. Just go.
Great. That's a wrap.